Welcome to the Functional Medicine Foundations podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Welcome back, everybody. Thanks so much for joining us. I'm here with Dr. Charles Penick, who is the medical director of Renew Institute and a visionary medical leader who specializes in functional medicine, regenerative medicine, and detox, delivering personalized and cutting-edge healthcare solutions. He is passionate about setting the trajectory for a strong and healthy life while promoting true vitality. Dr. Charles Penick has an extraordinary breadth of knowledge and expertise, extending far beyond his rigorous medical training. With extensive proficiency in nutritional health, detoxification, medical fitness, and health optimization, he is at the forefront of the latest scientific technologies and breakthroughs, ensuring his patients receive unparalleled care and treatment. And I can speak to that because I've got to practice with him alongside him. Shouldn't say with him, alongside him for about 4 or 5 weeks now. And it's been such an honor. Welcome back.
Thank you, Amber. You make me sound really good.
Oh, we could go on and on. That was just a short overview of your bio. So I kind of view this as like part 2. If you haven't, everyone should do themselves a favor and go back and listen to my initial interview with Dr. Penick, just talking about the principles of detoxification. It was a really powerful conversation. But I think today we wanted to spend a little more time kind of digging into, I view it as more chronic complex illness and these invaders that are in our bodies that should not be making a home out of our body.
Yeah.
And, I know you really view a need really worldwide for these people, mold, Lyme, chronic fatigue syndrome. They need help. Certainly. They need answers. And I know you are a physician that can give them answers and bring healing to their lives. And I don't think it's fair to say, let's start with mold, let's start with Lyme, let's start with maybe parasites or infectious disease agents. I think it's really all inclusive, right? Right. Because oftentimes they go hand in hand.
That's a really great point because it's easy for us. It's easier for us to compartmentalize when we're trying to attack something, right? Right. And this is what you have, and this was kind of addressed actually at the conference that we both attended this past weekend, right? And we see often that there's a fad of something to attack. Okay, we're gonna. Everyone, we need to really look at Lyme, or we really need to look at mold, or we really need to look at parasites. And so we make that thing the enemy, which is just a small part of the picture. Actually, that was one of the slides even that was shown, was the idea of the elephant, and the blind men, right? So a blind man's feeling the tail and describing the elephant as what he feels the tail is. And so, or one on the trunk and feeling, this is what an elephant feels like. And what we end up doing then is, honestly, we're just focusing on a piece of the picture. And that's, I think, one of the reasons why a lot of times we're realizing that people are having a slower progression because we're just trying to hyper focus on one aspect of a much more complex, or I don't want to say complex because to some degree it is simple, but it is a lot more holistic. We need to look at take a step back and look at the whole picture rather than, piecemealing it so much. Yeah.
So let's just set the stage with what kinds of patients are we talking about? What are their symptoms? Because some people might not even know, like, well, how do I know I'm in that category? I know I don't feel great. I know I'm not living my best life, but what are the symptoms that we should be looking for in these kind of people that need to start thinking about these different ailments, these different infections?
I would say it's definitely quite a wide range. And there are some individuals who have been struggling with some things for a while that are very generalized, like fatigue, brain fog. We may look at their labs and say, oh, wow, your hormones are really off. So let's balance the hormones. But why were the hormones off in the first place, right? And so those are very common, very, very common. And I would say the majority of us, I'm saying us because I would put myself in that category, may have some symptoms that are related to these foreign invaders in our body to some degree. I can speak about myself in the sense that I have done testing on myself and I look and I'm, wow, there's some environmental toxins in there. Wow, there's some mold, there's some mycotoxins present. I'll mention really quickly with parasites. There are a number of parasite tests out there, but I will tell you that they only test for a small portion of what we believe truly to be out there. While I don't know a number. I will say that let's just say, for example, your average parasite panel may include somewhere between 10 and 20. I'll just throw that out there as an example. Whereas in actuality, we may be looking at something like 10 times that number that actually exists. And that may be even a fraction of what actually exists, to be quite honest. Right. Because if we think about bacteria, I mean, there's billions, right? And so, so what's to say that parasites don't at least have hundreds of varieties out there? Right. And so we don't necessarily test for that. To quote Dr. Todd Watts, if you have a pulse, you have a parasite, and that is most likely the case. And so back to myself, using myself as a case example, then let's just say I'm, feel a little off, word finding, brain fog, fatigue. And then I check a lab panel. Okay, there's some low testosterone there. I need to fix that. Well, ultimately, there are a number of things that play into that. And it's more holistic than just foreign invaders, but that's always a piece to some degree, generally, because what these things will do is they will block cell receptors. Mm-hmm. They will decrease production of certain hormones. Mm-hmm. The inflammation will actually decrease the function of the cells signaling to one another. So that inflammation will cause one cell not to be able to put out a signal and the other one not to be able to receive it. So it's blocking that cellular communication. Absorbing certain nutrients that are precursors for the hormones even, right? And so because the inflammation can be downplayed. And so it really does have a part to play in the majority of our lives. But let's go down that spectrum. Back to your original question, let's go down that spectrum to the further end. And these are the people who are chronically ill, where sometimes it puts people in bed. They're bedridden. Yeah. They don't have the energy to actually get out of bed and function. Right. Their memory is very poor. Sometimes people have to take time off of work. There may be symptoms along the lines of rashes that just all of a sudden break out because they're so inflamed and they have this massive histamine response. They can't degrade histamine. And we may have people who have severe gut issues, bloating and constipation and diarrhea. Sometimes is a part of these things. I would suggest that some of these abnormal things would be migrating joint pains, electric-like shocks that shoot up the spine, or numbness and tingling randomly in a hand that comes and goes, right? And there's other reasons why these things can be present, but these are just a myriad of symptoms that are often chased, right? Oh, you have numbness and tingling. Let's see if you have carpal tunnel, right? You have anxiety and depression. Well, let's put you on a depressive med. But actually what's happening is the brain neurotransmitters are off because of these foreign invaders, right? Mm-hmm. So it's a really interesting thing because it's so easy to chase the symptom and not dig a little bit deeper into the root cause. And it's not always easy to test for that root cause, right? Let's say Lyme, for example, was a contributor. Well, if it was even considered that Lyme was a contributor by the practitioner, how do you test for that? Yeah. Right. And so then you could be spending quite a bit of money on a test that comes back as negative or equivocal. Mm-hmm. Yet it could still be the case that it is related to Lyme. Right?
I wanted to go there, like quantifiably, right? Some of my sickest patients, that panel's not impressive. Mm-hmm. There's hardly any mold on board. And we know some of those people just might not be detoxing mold at all. But it's like, you're sometimes not that impressed with some of the tests. Mm-hmm. So it's not at all quantifiable. It doesn't all mean that patient isn't actually sick or isn't actually toxic.
That's right.
So what are you thinking in those people?
Yeah. So thankfully we do have symptoms. There are people much smarter than I who have put together questionnaires that we see a common pattern among clients who are dealing with, for example, Lyme or mold. And there's a lot of crossover, by the way, between those. And so those questionnaires are very helpful in guiding, okay, it's a very high probability that even though you may have a negative or equivocal test, that there may be something still present. On the testing, I will mention that it is hard. It is difficult to have an accurate test with Lyme for a number of reasons. One, they are very good at walling themselves off with biofilms, right? The other reason is they don't like to hang out in the blood. So you're trying to draw blood and test the blood, but that's not where they hang out. Mm-hmm. And so there are certain things techniques that we want to use, and we want to use a lab that's vetted and proven to be effective. And so what we try to do is, if we do test at all, we try to look at what are the results we're getting? What do the experts have found to be consistently accurate? There's only one that I know that's above 90%. There are a couple of others that may be in the 80% range as far as truly accurate. Right. But that being said, I also tell my clients, we don't necessarily have to test. Now, everyone's going to have a different philosophy. This is my personal philosophy, is that if you meet enough of the symptoms, it actually doesn't hurt. If we're not, so let's go back to this philosophy of risk versus benefit. So if we're using something that can be a very harsh drug, you want to be pretty dead on accurate that that's what you're going for, right? But if you're using something that has multiple benefits and very low side effect profile, then there's really no harm in approaching the treatment. Take that money that you're going to put towards a test and let's put it towards actually treating, because even if that's not exactly what it was, it will actually help to balance out the body in other ways, right? And so that's the principle that I try to approach the treatment from. And I will sometimes leave, I always leave it in the hands of the patient, but I mean, sometimes I will impress the patient more. This is my recommendation that we do go for testing, but sometimes I kind of leave it in the hands and say, hey, if you really want objective data, this is the test I recommend. If you want to just take those funds and put it towards the treatment course, then let's go that way. And so, more as a coach, so.
Absolutely. I love that you touched on just that the conundrum with testing for Lyme, because it is pretty controversial out there. Same with the testing for parasites, right? Parasites don't always hang out in the colon. And when you do stools testing for parasites, you can only look at what's in the colon. But what about the liver? What about the kidney? What about the brain? Parasites like to hang out in a lot of different parts of our bodies. I actually had a patient, mold parasitic patient that, as soon as we started to push detox, she couldn't get in the infrared sauna for more than 10 minutes without head to toe eczema. And as soon as we started to clear the mold and we soon realized that parasites were a problem, she had synovitis on both of her wrists. Parasites.
Wow.
They the synovitis looked like worms.
Wow.
On her wrists. It was wild.
That is
and
impressive.
Sure enough, we started to do parasite cleansing and went away. The synovitis on her wrist went away.
Talking about places that parasites can hang out, I don't know if anyone has ever closed their eyes and kind of looked towards the sun, or if you've been in a red light, doing red light therapy, or in an infrared sauna where there's red lights available. And you can see, that orange glow with your eyes closed because the light's on the other side. And you see something, if you focus on it, it'll weird you out, but you'll see something wriggle across your field of vision. It's hanging out in the fluid there in intraocular space, or potentially maybe coming through the tear ducts. But they are so prevalent. Some people believe that, again, not to be overly descriptive, but sometimes if you're, say, clearing your nostrils out and rather than having a mucus that's in a ball form, but it's in a string form, that's just a mucus covered parasite. Actually, they can be quite small. So the prostate is another place, and it's an interesting concept, but it's warm and it's filled with fluid, and it's a repository for fluid. It has fluid that passes through, but it's a place that they will actually hang out in the fluid, and they will actually then embed themselves into the tissue, causing more prostate inflammation. I'm not saying that parasites are what causes prostate hypertrophy, but they can certainly be a contributor, right? And so same with the colon. How many people have had a colonoscopy and they're like, well, if I had parasites, wouldn't you see that when you had the colonoscopy? Not necessarily, because even though the colon is cleaned out, they know how to embed themselves, bury themselves, hide in the tissues. And so another reason why testing for parasites can be not very accurate, because they have the ability to recede and hide. They also can use biofilms to cover their tracks. And so schistocytes, I think specifically a certain type of parasite, can actually shift their antigens. So they will have a certain type of antigen that they release, but then they can actually change it over time and camouflage themselves. So it's so concerning. I hope no one's eating their dinner or their breakfast right now, as we're talking about parasites and nasal cavity and in the prostate. That's fun. That's fun stuff. I loved, you're doing a lot of hormone pelleting in our practice, which we're getting really, really great results from. But I love, I'm sending my clients to you. I'm not trained in that. I sent a gentleman to you and I kind of presented him to you and said, hey, I really think he'd benefit a ton from testosterone pellets. And I loved your approach. And this is where you're such a practical practitioner. He's all of his markers. I know if we detox him and got him away from the environmental chemicals, we know his testosterone would be at least close to optimal, and he'd feel a ton better. But that would take a year, maybe 2 years, maybe 3. And the whole time he has to struggle. And so I love that you use
the certain techniques that might not be true root cause medicine to get your patients feeling better.
Yeah.
And then we can work on the root cause, and then we can work on the detoxification and clearing the body of parasites.
And, now that individual hopefully has more motivation and capacity to stick with the protocol. Right. And, a lot of people, I think, will start a journey, and then often they'll fall out because sometimes they need that quick win. Right. Yeah. And that's where the hormone pellets have been an awesome, approach to giving them a quick win while we dig at the root cause that will take some time. So,
it is that motivation they need. And let's be honest, when you start to really do the work and get on some of our protocols and do some of the detoxification, you can start to feel worse for periods of time. That's right. So talk about demotivating. So if we don't, fix these people, what we call non-negotiables, if we don't get them sleeping, if we don't get them, able to exercise a little, those are all really important aspects of healing that they need. That's foundational.
Yeah.
So it's really cool. So I kind of want to touch on, we've got Borrelia or Lyme and mycotoxins, which is mold. What are other infectious agents that you think we need to be paying attention to, or we, as a community, paying attention to, just awareness of other things that can really damage and impact our health?
Yeah. So, the broader category, I would say, I like to use the word now when I'm talking with clients, I would say foreign invaders. So, think about, let's just say your home, your house is your home, right? And say it was your physical home. If there is someone that comes in uninvited, especially if they don't come, let's just say, for example, with someone that you knew, they use the front door, you're less alarmed at first. Okay. Your front door is your mouth, right? So your body has an easy capacity to usher something right back out. If it comes through the back door, that's like an injection that's going right into the body, had no chance to be selective about it getting into the bloodstream or through the skin transdermally, right? Those are a couple of ways that we see things that they cause an even more abrupt reaction because the body didn't actually have the chance to say, hey, I locked the front door, but you just climbed through the window. So now all alarms are off, right? Because that was exceptionally unwarranted. And so what does it do? It triggers an inflammatory response. This is a non-native thing, whether it's a bad bacteria, whether it's a parasite, a chemical toxin, heavy metal. We often throw viruses into that category. The jury is out. I won't go down that rabbit hole, but on what that actually is, that's what we call them. But what that actually is, and the other one would be, of course, fungal elements, right? So that kind of goes into the mycotoxin, right? So we have these fungus that can grow externally, but it can also set up shop internally, and they release toxins, mycotoxins, right? So any of these things can trigger this massive inflammatory response, and our body is supposed to do that. That is the way we were designed and created, so that it can attack and get rid of that. However, if for some reason there is a lot of it, or our detox pathways are off, or because of our genetics, right? Or there's other stressors in the body that it's not in a position to deal with an extra stressor, then what happens is that acute inflammation may never ramp up in the first place, and it's just chronic underlying smoldering inflammation, or that acute inflammation after time, the body can't sustain that amount because it's not getting it out. So it goes into this long chronic inflammatory state. And that's where we see people who, can go down that path, if not dealt with, to a place of being almost debilitated. Right. And our goal is to figure out, how do we put the pieces back in place to walk them back to that state of health, hopefully better than they were ever in the first place.
Right.
Yeah.
So no, go ahead.
Well, I was going to say, and that's a big piece that I think happens during this journey when you're going downhill, or you're in the valley, is losing hope. Yeah. You feel like, I've seen a number of practitioners, and I'm not getting help. I felt better when I started this therapy, and then now I feel terrible again. Or I've seen, doctor, and they prescribe such and such drug, and then I went and saw this specialist, and then they referred me to the neurologist, and then to the rheumatologist, and then I went and saw the psychiatrist. I mean, this is story after story, right? No. And they're still suffering, right? Yeah. And so it's very easy to lose hope. And so I hope that, in part, this podcast imparts hope to individuals to know that you're not alone, and that there is an answer. There is a reason why this is happening. And I'm going to put a different spin on it, rather than looking at it as a negative thing. And I know this is kind of an interesting statement. Be thankful that your body is talking to you, so that you can do something about it. Because the people who their body is silent are the people who end up in a state where they're worse off. They wake up and they're diagnosed with stage 3, stage 4 cancer, because that invader slipped in and did not cause that inflammatory response that gave them sick symptoms. And they had no clue until the day they were diagnosed. Right. And that's why it's important sometimes to screen for these foreign invaders, even when you may not be super symptomatic. Right.
Yeah. Well, it's also a reason to take good care of yourself, because if you're not moving daily, you're probably going to have joint pain, and you're probably going to put on weight that's going to cause extra pressure on your joints and cause the insulin resistance that I mean, you start to slack off on really taking care of yourself. And that's when you lose that ability to be really in tune with your body and know that something's wrong. And you hear all those stories, people that, stage 3 cancer. Oh, I should have paid attention to that symptom. I should have paid attention to that sign. I wasn't really aware or in tune with my body, because I live in America and I fill my body with poisons every day. And yeah,
that's right. And then, I didn't put it into this category, but I often put it into its own category of psycho-emotional imprints. But you can look at, emotions, these negative emotional imprints as another type of foreign invader, right? Negative energy.
Yeah, absolutely.
Because they are always a piece, whether they're the main piece or just an adjunctive piece, they're always a piece of the puzzle. Stressors from relationships, stressors from jobs, stressors from, changing, physical locations, or the death of a loved one, or, whatever it may be,
unresolved
you name
grief,
it. Yeah. Unresolved grief. We understand enough now to know that some of these things can be passed down, even though we didn't experience it in our lifetime. They could have been passed down from grandmother. We know at least 3 generations.
Generational trauma.
Generational trauma. Yeah. And this is both proof scientifically, but even biblically, the Bible says into the 3rd and 4th generation. Right. And so, it's been reproduced in rat experiments. People who lived in Japan during, the bombing during World War II, and so on and so forth. It's been recreated. There's a really good book that touches on it. I was going to say The Body Keeps Score, but it's actually it's called It Didn't Start With You. And so both are great books. But that being said, that's another piece that we don't ever want to overlook. And you and I were just chatting before we started the podcast about this idea that when we deal with the emotions, we will see people clear certain things that they may have been on certain supplements. They may have been, on certain protocols, and they were making some headway, but this massive shift took place once the emotions were addressed. And then all of a sudden the next day, wow, look at all the parasites that I dumped, or wow, I feel so much better today. And so, that's a piece of the puzzle that always has to be addressed also as a foreign invader. It doesn't belong that energy, that emotional imprint does not belong inside of your body, and it needs to leave. So
I think when I first started doing some more detoxification work 3 or 4 years ago, or working more with mold and Lyme patients, the rebalancing of the limbic system and working on the nervous system and working on that trauma piece. And I don't like to always use the T word, because I think people are like, trauma, oh, that feels so heavy. That's not me, but we all have trauma. But anyways, I think it used to be something that I would implement if they didn't tolerate a detox, or if we couldn't push them to a certain point. And now it's like, that's where we have to start. We can't ignore that. We can't move the needle if we don't start there.
Yeah.
So I think we've talked a lot about the nervous system and limbic system, but let's pause. What's the limbic system? Why is it so important? Why do we all need to pay attention to it? And why are we now saying that's where we start?
Yeah. Because, in the past, we've always said, you start with the gut.
So true.
Yeah. Which is a huge piece of the puzzle. But before that, the gut serves as a repository for an impressive amount of neurons. And it also actually creates a lot of neurotransmitters, right? And that's one of the reasons why we talk about starting with the gut. But there's nerves that innervate the gut. And the vagus nerve is one of the most important. It's a cranial nerve. And when we talk about the nervous system, we talk about the autonomic nervous system, and we talk about, which is broken into 2 pieces, which is your sympathetic and parasympathetic, right? So autonomic nervous system is the part of our nervous system that we're not necessarily giving commands to. It kind of runs on autopilot, if you want to say it that way, right? We don't tell our heart to beat. We don't tell our lungs to breathe. We don't tell our stomach to digest, and our colon to absorb nutrients, or small intestine to absorb nutrients, right? These are things that happen without us thinking about it. That's run off of our autonomic nervous system. And when we talk about sympathetic versus parasympathetic, you often hear fight or flight versus rest and digest and repair. And so when these foreign invaders come in, they trigger this response, right? That is that fight or flight. And we want to get back into rest, digest, and repair, where the limbic system is what remembers, if we want to call it trauma, or changes to what causes our body to feel safe and secure. And so these are imprints that imprint on certain parts of our brain, the hypothalamus, the amygdala, the hippocampus. These are places that remember how to keep us safe and secure. And so once that limbic system gets triggered, it can be very hard to reset. And so whether it was an actually emotional trauma, or whether it was the body said that the limbic system was triggered because of a parasite or a virus or a heavy metal that slipped in through the back door.
It doesn't have to be sexual abuse as a child.
Correct.
It doesn't have to be this traumatic divorce or a traumatic car accident.
Right.
I think people need to understand it can be small shifts.
That's right.
Invaders to your body.
Yeah.
Being chronically dehydrated.
That's right. Yeah.
Or sleep apnea, just sleep deprivation. Those can be some of these triggers that people need to start recognizing.
That's right. And on that note, just, this is, thought came to me about how we know those things are going to happen in life.
Right.
And that in the end, they make us more resilient. Right. And that is what happens through stress. But many people go to a place, and this is just a natural response, where they get stuck. So, the limbic system gets challenged, and then we want it to be able to adapt and respond accordingly and come out stronger. But unfortunately, too many times it gets stuck. And so our goal is to bring it back to a place where it has plasticity, right? Where it's malleable and it's not frozen in fear, right?
Yeah. Yeah. Our health coach talks a lot about like using a rubber band, just being flexible, being able to grow, but come back and relax and grow.
Yes. Yeah. So I would say, that is the piece, that is the starting point, because if that's not in a place where it's malleable or it can grow and mold, then the body is very resistant to change, right? Because it's like, I'm going to stay here because I'm alive right now.
Right.
And if you push me out of this state, I don't know if I'm going to stay alive. Right. I'm not secure anymore. And so we have to calm it back down. Yes. Yeah.
Okay. So what are some of the techniques? What are your favorite techniques that you think work the best to make sure that the body, the brain, the nervous system feels safe?
There are so many, and there's probably so many that I don't know. I feel like I'm always learning of new ones.
Yeah.
But specifically for the limbic system, tried and true, Annie Hopper's dynamic neural retraining system, DNRS, Gupta's program, the Gupta program. There are others out there. Actually, I've recently learned of another one. I don't have the name of it. It was told to me by another practitioner who has referred it. It is the same general concepts. They put it in they wrap it in a Christian delivery format.
LimbicSystemRewire.com.
Thank you so much.
Yeah.
All right. Appreciate it.
They do really good work.
Thank you. Yeah.
It's a little more expensive than like Annie Hopper's or the Gupta program. But for those that are looking for that more faith-based, I've heard really good feedback from my patients that are doing it.
Yes. Yeah. Thank you. That's a great, and these are something that anyone would benefit from. Yeah. You don't have to be chronically ill to benefit from these programs, honestly, because all of us have, like you said, have some small trauma in some way. I like to use, when I talk about psycho-emotional imprints, I like to use the analogy of first day of school, for someone that may have been, dropped off by mom or dad, and up to this point, their safe and secure place is home and mom and dad. And now you're leaving me with a teacher I don't know and kids that I don't know. Yeah. And you walk in and you're wearing glasses, and some kids yells out 4 eyes, and all the kids start laughing, and you're like, do I start crying? Yeah. Do I start yelling and screaming? Do I run and leave the room? Or do I hide, put my head down and just close my eyes? Or do I just play it cool and act like it didn't bother me? Yeah. And at the end of the day, they are all different responses to handling this stressor, but it made an imprint on you, whether you want it to or not.
And
right?
You carry that.
And you carry that. And you don't even remember it.
Yeah.
Right?
Yeah. So true. Yeah. I don't really want to go there because it's so heavy on my heart, but just the thought of, it just reminded me, I have this analogy of kids in their first day of school. How about the kids that went to their first day of school and their faces were covered and they couldn't tell emotion or see if their teacher was smiling or see if their classmates were pleased with them?
Yeah.
Right. We've got this whole generation who was introduced to society not knowing what anyone's emotions were. Yeah. Right. I mean, that's a whole new hit to the limbic system that we probably don't even know how to deal with. Yeah.
It'll be interesting to see the repercussions of that, right? Because we underestimate the fact we have good linguistic skills and, you know, we can interpret certain things because we had the opportunity to develop that skill set. And for 2 to 3 years, many kids, all they, you know, their ability to grab those cues was very diminished. So, yeah.
Are you tired of feeling sluggish, dealing with unexplained health issues, and struggling to find answers? It's time to reclaim your life and take a deeper dive into your health. Our detox expert and Renew Institute's medical director, Dr. Charles Penick, specializes in evaluating and addressing the root cause of health issues related to Lyme disease, mold exposure, heavy metals, toxic chemicals, environmental toxins, and so much more. With Dr. Penick's expertise, you can finally address the underlying health issues that have been holding you back. By evaluating your individual situation, he can help you uncover the root cause of your health problems and design a personalized detoxification plan. Don't let your health be compromised any longer. Visit renew-institute.com/detox to learn more about how Dr. Charles Penick can help you detox your body and reclaim your life. Your journey towards optimal wellness begins now.
So you start a lot with a lot of that work with some of these programs with your patients with chronic complex illness.
Yeah, I'll do it in conjunction because it's not a therapy that you just you know, hey, I'm going to do this for 10 days and I'm on to the next chapter, right? It takes some time. I would say a minimum of 12 weeks or 3 months would be recommended. You know, some people may say, hey, I felt you should see shifts before that. But the point is, it's not, oh, I felt better because I've been doing this for 3 weeks, so I'm done.
Right.
The point is you're trying to retrain, right? Which, you know, it's just because you went to the gym and worked out and, you know, you're like, oh man, my muscles look really good because I worked out today. Well, great. You know, wait another week and they'll be back to where they were, right? If you don't go back. So the idea is you have to retrain your system. And so I would say, you know, no shorter than a 12-week period in conjunction with the other therapies. Now, sometimes people are at a place where that's all we can do.
Right.
And you'll know that because as you recommend a therapy, you know, start with a gentle therapy. And if they react to that, like sauna, some people are at a place where they can't even stand doing a sauna, right? They're not ready. Or liposomal glutathione. And they're like, man, I took this glutathione and I reacted, right? Some people are that in that place. And so for that person, it's just limbic system alone.
Okay.
And then we build from there. So, yeah.
And I know most practitioners will say you start with mold because you can't clear the Lyme, you can't clear the other infectious agents until you clear the mycotoxins from the body. Do you agree with that approach?
I do. And I would say one addition to that is if we think about the lowest hanging fruit, I actually think the lowest hanging fruit is actually, and this is a statement where there's always,
you can't
push everything into one basket, right? Because someone say, well, actually the lowest hanging fruit is, and I would say, oh yeah, I agree with that. Right. Yeah. So, but I would say if we're thinking about these foreign invaders in the categories that we already spoke about, and I'm kind of pulling the emotions to the side because that's fully integrated in this whole process. But if we're talking about physical, foreign invaders, I would say parasites are probably the lowest hanging fruit.
Okay.
You know,
I figured you were going to go there.
Yeah. And so, but when we think about Lyme, you can't clear the Lyme very well without addressing the mold. But I do think that, and this is my take on it at this point in my practice, that people will move forward in their mold detox better if they've cleared the parasites. And there's a number of reasons. One, the parasites we know are generating an inflammatory response. Number two, they are leaching your cellular energy like crazy. They're living off of that. So that energy that should be going to rest in healing and repair and clearing out other invaders, guess who's stealing all that? the parasites. And so imagine if you could flush those out and return that energy. Now all of a sudden the mold toxins are just pouring out and you're moving along. And so I would say that, you know, there may be some good philosophical discussion or even scientific input on this from other practitioners. And I'd honestly love to hear it. And because I'm constantly in a state of learning, but where I'm at this point in my practice, I would say that the parasites are the lowest hanging fruit. So
that's really good to hear. Yeah. I think about, there's so many young people, athletes dealing with iron deficiency. And it's like, parasites, they love to eat iron, right? Or low ferritin, low stored iron. Like, oh, you just want to like shout from the rooftops, like think about parasites. So again, practically speaking, I agree with what Todd Watt says, if you have a pulse, you have a parasite, everybody needs to be in a regular practice of parasite cleansing, which some people would think that that's crazy. But how can we, especially with young children where it's a little bit harder to do parasite cleansing on, how can we avoid parasitic infections in our environment? What are some of the main ways you think that we get these little bugs in our system?
So from a philosophical standpoint, the imagery I like to use is a bucket, right? So we come into this life with a bucket. It's typically not empty, actually. A lot of things are passed down. As many as 150 different toxins have been demonstrated to be present in a newborn infant, passed down from mom and grandmother, potentially great-great-grandmother as well. And so, here we are, and our goal is then to drain that bucket and limit the amount of the new things that come in. So, with your question, we know that, there's some parasites present, but our goal is to limit the new added parasites, right, from coming in. And so, there's probably a lot around this discussion as well, but from a diet standpoint, I would suggest that there are certain foods that we know are much heavier, have a much heavier content of parasites. Pork being one of the biggest ones. So that's kind of goes without saying. And things that are some of these things don't apply necessarily to the US, but you go to other countries, you'll find a smorgasbord of things that we don't eat here that are found there. Rodents, right? Like that sounds pretty gross to us, but for some people that's a part of their diet, right? They're pretty parasite ridden. Matter of fact, so are regular things like beef and goat and lamb can have them, right? They're less amount for sure. And so I'm not saying run out and be a vegetarian. But one thing we do notice is that sustainable ranching practices and farming practices keep the parasites very, very low. If not, I would hesitate to say parasite free, but in a way that because nature is in balance, the parasites don't have a attachment point, and not saying in a physical sense, but in a sense of an ecosystem. They don't have a place in that ecosystem where they're thriving. They're thriving in places where the ecosystem is out of balance, right? So you throw a bunch of cows on a dirt farm and you're feeding them grain, which is non-native to their diet, and you're giving them antibiotics and hormones. Well, all of a sudden, the parasites have a wide place in that ecosystem, right? But in a micro ecosystem where it's much more natural, the way things would have been done 1,000 years ago, 500 years ago, even 200 years ago, we find that the parasite content is quite a bit low. So pastured pork, much, much cleaner.
Yeah.
Okay. But I will say, and this is not a slight to anyone, but I will say this is a fact that pigs don't sweat, and we lose a lot of toxins through our sweat. And we do find quite a bit more parasites in pig fibers, muscle fibers, as a source. Now, plants are not necessarily parasite free. Some plants actually may have some parasites that grow on them. And fish for sure are not parasite free, right? So, so it's not like the bad guy is not necessarily a certain type of fish or food source. Let me say that, right? The idea is that we do want to go back to sustainable practices, right? A lot of fish, a lot of people don't know this, but a lot of fish that are even considered to be wild caught are harvested from these nets that they drop down, and they make these microenvironments where they actually put chemicals that kill the plants at the bottom so that they can call them, wild caught, even though they were still harnessed in this small ecosystem. And if you were to follow those nets down to the bottom of the ocean, you'll find a dead plant life down there, right? And so, what I'm getting at is we need to go back to what's natural, what's natural, and that will keep those systems down. Now, what another natural thing that has been done for thousands of years is parasite cleansing.
Right.
So,
and we still do it to our animals.
That's right.
What kind of dogs don't get the what is it, antiworm or what they?
That's right.
They're dewormed.
That's right. They're dewormed, right? So
we don't do that to our children.
We, yeah.
We just vaccinate them 4,700 times a year.
How do we, you know, think that we're exempt from this, right? And so at the end of the day, you know, if we look at all ancient cultures, it's very common that there was some form of anti-parasitic activity or ritual that they were doing. And so we need to bring that back, you know? Yeah.
I agree. So I have to just go there. So I've heard you say that multiple times that pigs don't sweat. Do cows sweat?
My understanding is that they do.
Do they?
Yes. Yeah.
We have cattle. We raise for beef. I'm going to go pay attention to that more. I'm going to pet them and see if I can feel sweat on a 95-degree day.
I don't know what other animals, but as far as our general food source, my understanding is that as far as common livestock that's raised here in the U.S., that pigs are the outlier in that category. I
mean, honestly, pork, unclean. It's biblical too. So
the Bible says something about the pig and the rodent, or the pig and the rat or mouse or something there. I'm totally butchering
you don't eat mice
this.
Either.
So yeah.
Just making sure.
And you're kind of like, dude, those are two separate things. I wouldn't eat I wouldn't even eat that, but you're going to mess with my bacon. I don't mess with my bacon, right? Totally. Oh, by the way, let me just throw this out there, you guys. So if you're struggling with this because of the bacon, and I can totally understand that, because the first time I had a bacon wrap date, it like blew my mind.
I always thought he was going to say like a bacon cheeseburger, but bacon wrap date, he went there.
Yes, with blue cheese, man. Yeah. But I will say that to comfort you, that if you are into lamb or beef, and you know, man, filet mignon. I mean, yes. We can talk about that. Yeah.
He's like, nope, cows definitely sweat. I promise. I won't give up my filet.
For sure. Right. No. But what's cool is that more and more options are coming out there, but they're doing more beef bacon and lamb bacon.
Really?
And, oh man. And so some members of my family were recently introduced to pastured beef bacon, and they said it was the most amazing thing they'd had. And in their mind, it compared up there to pork bacon.
Where do we find it? Do you know where you find it?
So that's a really good question. So my understanding, and I have not vetted this with the company, is that they're working on coming out with producing this, or actually, I think it's already in production, and you can purchase it from Paleo Valley.
Oh, cool.
Yeah. So, awesome. And they're awesome company, awesome people. They understand how to bring in clean meat and sustainability. And so, that's one location. I believe White Oak Pastures is another, source. And then there are others out there. And if people are listening to this and there's a comment section below, and you know of a place that has sustainable, clean, organic, pastured, animal products, then I would say drop it in there so we can share this good information. So
it's really important. Our listeners would be really curious about that.
Yeah.
So awesome. We could go on and on and on. Okay. Part 3 coming soon with Charles Penick. I like to end each one of my discussions with just on this topic of, reclaiming your health and these infectious agents that don't belong. What's one piece of advice you can give our listeners that you like to give your patients that moves the needle the most for them, has the most significant impact on their health?
I will throw this out there just because it's on my mind after this conference, the Cellcore conference that we attended. And I will say that we often focus so much on the physical aspect. And I feel like one big takeaway, and I think also something that's often impressed on my mind because it's the easiest to skip over, is the non-tangible things, right? The emotional and the spiritual. And it was interesting because we were talking about this 2 days ago, my wife and I, and we had company over the house. And, my buddy, Tomas Jajina, he's a physician in Oregon, and he always has this very out of the box approach or viewpoint to things that challenges my thinking and our thinking as friends and practitioners. And I always loved that. And so, he was getting back to this idea that if these things are in your body, it's because there's a reason. There's an imbalance, and let's just say this, for example, say I eat a ton of sugar. That sugar, if I didn't have compensatory effects, could kill me. Well, what's one of the compensatory effects? Candida. It's going to grow and it's going to eat up that sugar so it doesn't kill me. So it actually is beneficial in that moment, right? we think is, oh, that's the enemy. We got to get rid of the candida. But the candida is growing because otherwise our blood sugar level would be so high, we'd be in a coma, right? So it's protecting you, right? So there's a reason that thing is there. H. pylori. I actually just learned this weekend. Some science shows that because we are dehydrated and we are in our gastric acid content is too low, that H. pylori comes in to create an environment that increases stomach acid. So we're making H. pylori the bad guy, but it's actually responding to a need in an environment.
Keeping your pH balanced.
Exactly. And so we often look at these things as the enemy. And so if we take a step back, God has created this thing where there is this balance, right? And when the need for that H. pylori changes because we're better hydrated and we have better stomach gastric acid, guess what happens? The H. pylori goes away. Right. And when we stop consuming so much sugar, guess what happens? The candida starts to die off. Right. And so what I'm getting at is what we sometimes do is we want to attack the physical thing because it's the easiest thing to go after. Right. But what we need to look at is the emotional and spiritual roots behind it. And when our body is resonating in a healthy state, and our state of mind is in a healthy state, we often find that our body comes back into a state of balance, that these things are not wanted or desired or needed anymore. They don't have a home there anymore, right? These parasites leaving because people address the emotional roots. And now this person is now resonating in a different place, a different frequency, a different frame of mind. Now that parasite no longer has a home because the need is no longer there. And so what I want to touch on is the fact that I want to encourage us to tend the garden of our hearts, because that is the root from which all of these things spring. And so what we had said was, I was thinking, I was like, man, I don't remember Jesus talking about a bunch of toxins in the Bible. But then I was like, wait a minute, there was one place I remember, and we were talking, it just came to my mind. It's like, wait a minute, the Pharisees were challenging him because the disciples weren't washing their hands ceremonially before they ate. And Jesus said, it's not what comes into the body that defiles a person, but it's what comes out of a man. And I think that really resonates with what we were just saying, is the fact that if we tend to our heart, from where, all these things start, our heart and our mind. Our mind is not just our brain. Our mind is this interface by which all of our cells are resonating and communicating with one another and storing information. It doesn't happen just in the brain, right? And so the heart is a huge piece of it, and the gut is a huge piece of it. I would say, again, not to go dive into another conversation, but think of the as far as anatomy, think of the brain, the heart, and the gut as being centers of energy collection that is shared throughout the entire body as this network, this matrix. And I would include that as a part of that is the fascia as another big topic, right? So, but the idea is if we can tend to that, we'll often find as we tend to that some of these physical things will no longer find a home there anymore. And so I don't want to underestimate the importance of the non-physical things, the emotional state of well-being and the spiritual state of well-being. So
that's so good. And that's something that'll really resonate with a lot of our listeners. Something they can start working on right now while they're waiting to get in to see you fix their mold and Lyme illness. Well, thank you, Dr. Penick. It's always such an honor. Thank you for your time and your expertise and your wisdom. We just value it so, so much.
For sure. Thank you.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, programs offered at Renew Institute, and the highest quality of supplements and more, go to fundmenfoundations.com.